Across the country, so much is decked out in pink for Breast Cancer Awareness Month. But now controversial new recommendations are challenging what all women have been told about the fight against the disease. Here's Chief Medical Editor Dr. Richard Besser.
Peggy Orenstein was big on pink. Though doctors said 35 was too young for her to have a mammogram, it found a lump and she had surgery.
I really believed that the mammogram that I'd had early on had been instrumental in saving my life.
But 16 years later, in spite of that early detection, Peggy's breast cancer returned. And she looked at the numbers. Between 1987 and 2010, as mammograms became the focus of the Pink Ribbon campaign, the rate of mammograms doubled. But breast cancer deaths decreased by only about 2% per year.
Early detection was becoming such a mantra, and it was so pounded into American women's heads that if it wasn't really decreasing the number of deaths from breast cancer, it was really important to find out why and what was going on.
Some cancer specialists think that Pink's emphasis is all wrong.
What we had hoped with the early detection concept is that we would be able to screen our way into a cure. But I think we have to accept that that is only part of the story.
Dr. Laura Esserman chairs a National Cancer Institute advisory panel that is calling for sweeping changes to how we treat breast cancer.
The problem with doing lots of mammograms is that the more you screen, the more you're going to find. But 75% of the biopsies turn out to be nothing. And sometimes we're finding precancerous lesions or lesions that we call cancer that in fact probably have a much lower risk of progressing than we had thought previously.
So cancers that aren't really acting like cancer.
Right.
One study estimates that 1.3 million women have gotten a breast cancer diagnosis for a lesion that would never have hurt them. That's about a third of all breast cancers detected.
So are you saying that women should not get mammograms?
I'm not saying that mammograms don't have value. I'm saying we need to do a better job of figuring out for whom they have value. It's time for us to explore and to understand who is at risk for what kind of breast cancer and to start to tailor our screening.
The panel recommends a revolution, scrapping the idea of annual mammograms starting at a certain age. Depending on risk factors like weight, alcohol intake, exercise, genetics, some women should have more screening, some less. And a radical step. Stop treating some early stages of low-risk cancer. Stop even calling them cancer. Because they lead to unneeded surgery, chemo and radiation, and all their side effects. But other experts say this is a dangerous path.
If you have an accurate diagnosis of something that can turn into cancer or can be lethal, even if the chances are low, as long as those chances are not zero, you have to treat it as a serious disease.
Women are afraid to do less, and I think physicians are afraid to do less. Mammograms are just one piece of the puzzle. 45,000 women are dying of this disease.
For Peggy, still in treatment, it's time to stop promoting pink and start focusing on research and prevention.
We are so overdependent and so overconfident in screening. But now it's the time to stop, reevaluate, and change it so that we can really make a difference in women's lives and health.
For This Week, Dr. Richard Besser, ABC News, New York.